ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਸਵਾਗਤ ਹੈ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਦੀ ਅੱਜ ਦੀ ਇਸ ਖਾਸ ਪੇਸ਼ਕਸ਼ ਦੇ ਵਿੱਚ। ਟੋਰਾਂਟੋ ਤੋਂ ਮੈਂ ਹਾਂ ਜਸਲੀਨ ਕੌਰ। ਅੱਜ ਅਸੀਂ ਗੱਲ ਕਰਾਂਗੇ ਬ੍ਰੈਂਪਟਨ ਦੇ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੀ ਮੌਜੂਦਾ ਸਥਿਤੀ ਬਾਰੇ। ਦੱਸ ਦਈਏ ਕਿ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ 2 ਲੱਖ ਤੋਂ ਉੱਪਰ ਕੇਸਿਸ ਹੁਣ ਤੱਕ ਕਨਫਰਮ ਕੀਤੇ ਜਾ ਚੁੱਕੇ ਨੇ ਅਤੇ 9800 ਤੋਂ ਉੱਪਰ ਡੈਥਸ ਵੀ ਰਿਪੋਰਟ ਹੋ ਚੁੱਕੀਆਂ ਹਨ। ਜੇ ਗੱਲ ਕਰੀਏ ਓਨਟਾਰੀਓ ਦੀ, ਤੇ ਓਨਟਾਰੀਓ ਦੇ ਵਿੱਚ ਟੋਰਾਂਟੋ, ਯਾਰਕ ਰੀਜਨ, ਪੀਲ ਰੀਜਨ ਅਤੇ ਆਟਵਾ ਨੂੰ ਹੌਟ ਜ਼ੋਨਸ ਡਿਕਲੇਅਰ ਕੀਤਾ ਹੋਇਆ ਹੈ। ਖਾਸ ਕਰਕੇ ਜੇ ਗੱਲ ਕਰੀਏ ਪੀਲ ਰੀਜਨ ਦੀ, ਤੇ ਪੀਲ ਰੀਜਨ ਦੇ ਵਿੱਚ ਬ੍ਰੈਂਪਟਨ ਦੇ ਵਿੱਚ ਸਭ ਤੋਂ ਜ਼ਿਆਦਾ ਕੋਵਿਡ-19 ਦੇ ਐਕਟਿਵ ਅਤੇ ਕਨਫਰਮ ਕੇਸਿਸ ਦੱਸੇ ਜਾ ਰਹੇ ਹਨ। ਬ੍ਰੈਂਪਟਨ ਦੇ ਕੋਵਿਡ-19 ਅਪਡੇਟ ਸੰਬੰਧੀ ਵਿਸਥਾਰ ਦੇ ਵਿੱਚ ਗੱਲਬਾਤ ਲਈ ਸਾਡੇ ਨਾਲ ਲਾਈਨ ਤੇ ਮੌਜੂਦ ਹਨ ਬ੍ਰੈਂਪਟਨ ਦੇ ਵਾਰਡ 3 ਐਂਡ 4 ਤੋਂ ਰੀਜਨਲ ਕਾਉਂਸਲਰ ਮਾਰਟਿਨ ਮਿਡੀਰੋਜ਼। Hello, Councillor Medeiros. Thank you so much for joining PTC Punjabi once again.
Thank you very much. It's always a pleasure to be here at the PTC Punjabi, and I hope everyone is safe.
Pleasure for us as well. Councillor Medeiros, as we know that Canada is right now dealing with the second wave of COVID-19, and if we talk about Ontario, Toronto, York region, Peel region and Ottawa are considered the hot zones, and if we particularly talk about Peel region, Brampton has most of the active and confirmed cases.
Yeah, and unfortunately, and you pointed that dead on, is here in Brampton, we're dealing with a couple of unique issues. One has been Brown, and Mayor Brown has talked about our essential workers. We have a big industry in Brampton of essential workers, so trucking, and when people go to the grocery stores, as a reminder, almost 40% of all goods movement in Canada comes through Peel region, and many of that comes through Brampton, a lot of the logistic companies. So many of our workers are on the front line, and I know our Dr. Lowe, for the medical regional doctor, our medical officer, he had expressed Ministry of Labor from the province to come and do specific checks in certain businesses and areas. A second, which we've noticed as well, is our crowded homes. As you know, some of our living arrangements, it's multi-generational. So when you have one person who catches it and there's multiple people living in the household, that seems to have that impact. And this, unfortunately, from a social aspect, we still have people who don't get the message or refuse to get the message, and they still have, even though we notice it hasn't been as much lately as before, but we still see some of this social gatherings, stuff we see on social media, some of the plazas again of young people at night, and that's a concern. But right now we're increasing testing. Mayor Brown has been very vocal about a lot of our testings, contrary to Mississauga, where they do testing on site at their hospital. We've had to send ours, and there's been a big lag here in Brampton. So hopefully the province is addressing that, and we'll have more capacity to do more testing.
The first thing I wanted to mention is, we're now in modified stage 2, and certainly respecting this provincial decision. But I have to say it's hard on our restaurants, it's hard on our community, but our small businesses are showing resilience, and we're looking at creative ways to support them during this 28-day period. It's not just a health pandemic, it's an economic firestorm. I want to thank the province of Ontario for their reconsideration of dance studios. I had a litany of complaints from dance studios saying that there was no data to support their closures, not a single COVID transmission in their environment. Jade's Hip Hop Academy was an example. They were paying $11,000 a month rent, and for them to have done nothing wrong, to have followed public health advice, to have no cases in the entire region, it was really a head scratcher of why they'd be closed down. The fact the province has now changed that frankly shows they're listening, and that's a good sign.
Councillor Medeiros, a couple of days back, the outbreak was declared at a childcare center and long-term care center in Brampton.
Yes, and so that speaks to what Dr. Lowe had suggested, that in some workplaces, be it or in certain sort of areas of isolation. So my apologies. The long-term care facilities, as we know, Tall Pines. Right now, I know staff are really looking to isolate that and we have regional staff, our public health experts are really isolating everyone and focusing that out area. And then the second was the daycare, and I know our regional staff is also dealing with that. So far, for example, our schools, I know there's been one school that's had a little bit of a situation, but overall, it's been, I think our schools have worked well. But we still do see in businesses that some employees are catching. There seems to be spread, a cluster in some of these businesses, and that's why our Dr. Lowe has asked Ministry of Labor to do more investigations in businesses in Brampton.
I know City is working on increasing the testing capacity, but what are the other additional measures, additional health and safety measures City is working on to stop the spread of COVID-19?
Again, taking our cues from our experts and Dr. Lowe, who I will have on a Facebook live chat that's upcoming Thursday, for him to be able to speak to residents directly. He had suggested that we have to maintain our social distancing, wearing of our masks, educate people, reinforce that message. We, from a bylaw perspective, we're going out there being aggressive in terms of investigating people who are not conforming to what the social distancing or what the numbers should be. So we're doing that, and we're working with Peel Police on some of these troubled plazas in terms of how we do more enforcement and working with the plaza owners. But it's very difficult when you try to regulate personal conduct, and unfortunately, what you've seen, we were all waiting for the second wave, and we were waiting for my understanding, between a 70-80 average here in Peel, and our Dr. Lowe has confirmed that it's been between 140, 150 daily average, much higher. So one of the difficulties that we have, notwithstanding people catching the virus, is our hospital capacity. So how are we going to ensure? So this is what sometimes people forget, that it's so important, notwithstanding not catching the virus, but we're trying to protect our hospital capacity, which we know here in Brampton is a challenge from the perspective of healthcare. And that's one thing that's really sort of shone a light on how underfunded we are from a healthcare perspective.
Councillor Medeiros, as we know that Brampton, along with other regions, was moved back to the modified stage 2, and we know that illegal social gatherings are still somewhere happening in Brampton, and in past few months Brampton had developed a reputation of COVID-19 party city. What do you want to say on that?
Well, I think that was a big concern. Yeah, during the summer, I think psychologically people thought that we got over a hump. You heard situations of backyard parties, weddings, things all over social media. I think lately a lot of it has stopped. I think a lot of it, people have sort of understand that, that we've seen a reduction. Unfortunately, just recently, as of yesterday, I saw on social media a plaza in my area, which essentially many kids with their cars were doing a big crowd gathering and hanging around and so on. And unfortunately, that maintains. So what we're doing about it, and we, our bylaw officers, enforcement officers, we're hiring more. We continue to do that. But again, we need people to stay vigilant, to watch what's happening and report it. But again, it's an upward battle. If people don't cooperate and maintain the social distancing, try to put off these parties, because the capacity to enforce all this is difficult. We're a huge city, and we try to remind all the time that we're on, for example, media and so on, that people have to have a duty to, at least, they don't care about themselves, but at least care about people around them.
Absolutely. Councillor Medeiros, we will continue this chat right here, but after a short break. Welcome back after the break. We have in conversation with us the councillor from Brampton, Martin Medeiros. Councillor Medeiros, as we were discussing before the break about Brampton's COVID-19 situation, as we know that Brampton has around 500 active and confirmed cases of COVID-19. So how are you making sure that, how are you monitoring, or how the city is monitoring that people are downloading COVID-19 alert app? Because as per the federal government, that app is the most effective way to take care of yourself and your family members.
Yeah, and that's a good point. That in terms of, again, how do you force people, similar to how do we force people to wear masks? How do we ensure that people are washing their hands? Again, it's about educating people to the importance of downloading the app. And the app is only as good. I have the app myself, and it's only as good as other people around me are using the app as well and provide that information. In terms of what exactly the city of Brampton, understanding that the federal government has been promoting it, I try to promote it when I'm with people and we talk about it. But I don't say that the city of Brampton has done a campaign to ask people to use it. And I think that's maybe a good idea on how we can work with the federal government in promoting this app. And it's important that we all use all the tools at our disposal. But again, when you speak to our regional medical officer, he will often tell us that there's no secret, there's nothing that people are required to do except the personal hygiene in terms of the 4 Ps. My apologies, which is really about masks, washing your hands, social distancing, those type of sort of initiatives. But I think the COVID app would help. And especially when it's unfortunate with COVID, and I know we touched upon on removing some of the going back into sort of the second phase is the impact on businesses. And certainly if from restaurants perspective, if there was more sort of people using that app, we would see that a lot of the spread doesn't actually even come from the restaurants, and they've taken a really negative impact on them.
Councillor, I would also like to talk about the businesses. We know that this is a small business week, and there are many small and big businesses who suffered a lot due to COVID-19. So what do you want to say to them?
Yeah, and that is one of the sort of sidebars of what's been happening. We talk about a public health crisis, but really, we hear people who are tired of being isolated, so there's mental health issues. And then after the businesses, I personally know friends of mine who run hospitality business, for example, either have a restaurant or have some type of cafe, bar, or these type of things. And I know they're suffering. There's many places that I would go have my coffee, and a lot of these are family-run businesses, and it's unfortunate that they're closing because they have no other sort of way to generate revenue.
So in Brampton, we're trying to do our best given this decision, and so we're introducing a few interesting new additions to our Halloween celebration. We're going to have the Craftiest costume competition. So for all those young people in Brampton, if you're under the age of 12, there's still opportunities to take home some candy loot. The prizes come from local businesses, and I can tell you the top prize is a chocolate bar the size of you. So if you're 10 years old and you win the best the best costume, we'll have a chocolate bar the size of you as your top prize. Everyone that is part of this competition is going to get a participation prize. We want to see some of the best costumes around the city, and details will be on the city website and our social media in the days to come. We're still going to have a blast celebrating Halloween, even if we have to do it from our own homes. We're also going to have a pumpkin contest. So for decorating your pumpkin, we're going to be having prizes for the top pumpkins in the city. So just because traditional trick-or-treating is canceled, it doesn't mean you can't invest some time and energy into the traditional Halloween events of incredible costumes and clever pumpkin designs. And so here in Brampton, we're still trying to make Halloween fun.
We must also celebrate Halloween differently this year. Do get dressed up, buy some treats, carve pumpkins, and decorate your apartment door or front lawn. However, shrinking our bubbles and staying home regrettably means traditional door-to-door trick-or-treating is not currently recommended for our community. And for our teens and our 20-somethings, now is not the time to throw a raucous costume party. The province's recent Halloween recommendation aligns with our key message. To stop spread, we must reduce our in-person contacts.
The only thing I can tell people, as much as that we feel bad, please turn that into action and support local business, and especially our small businesses. So when you're purchasing goods, when you're buying, takeout food or anything, please use small local businesses. They need our support right now.
Councillor, as we know that we are just days away from celebrating Halloween and festival season is also starting soon. So what health and safety guidelines city is working on to make sure that everyone is safe in the city?
Yeah, again, that's always, I know the city of Brampton has put out some of their sort of guidelines, which are based on the province that, any candy distributed, especially, if they're doing it in their backyard with their amongst family, but if they are either having some form of Halloween party or some form of gathering, that candy be in individual bags, that they use some form of tongs or so on to provide that. But essentially, what our medical officer in the province have told us is that we should not be doing trick-or-treating in Brampton, especially under our current state of situation. So I think that people have to understand, and for me personally, my birthday's on Halloween. So it's always a great event for me, and something that I always look forward to for all the reasons. But this year, unfortunately, similar to everything else, that we'll have to do something just with the family and, internally and really understand that it's for all our health and safety. But as far as I'm concerned, based on our medical officer, this year we should not have any trick-or-treating. And however, if people do engage in that type of activity, do individualize little baggies of candies and ensure that people are using some form of tongs and keeping their distance when distributing that candy.
We wish you a happy birthday in advance, and any message for the community?
Well, I think most importantly, I know psychologically it's difficult. We know that probably people are tired of listening to people like myself constantly repeat the same thing. There's no secret to this. However, like anything, we have to continue to socially distance, wear masks, wash your hands, and continue to do the sort of basics to really help us get through over this. This is going to be a difficult period. Every expert tells us over the next 2 to 4 weeks, this is a critical period. So I would ask everyone be safe and continue to follow those public health guidelines.
All right. Thank you so much for joining PTC Punjabi once again, and thank you so much for your information and your message to the community. Please stay safe.
Thank you very much.
ਸੋ ਹੈਡਲਾਈਨ ਕੈਨੇਡਾ ਵਿੱਚ ਇਹ ਸੀ ਸਾਡੀ ਅੱਜ ਦੀ ਖਾਸ ਗੱਲਬਾਤ ਬ੍ਰੈਂਪਟਨ ਦੇ ਵਾਰਡ 3 ਐਂਡ 4 ਤੋਂ ਰੀਜਨਲ ਕਾਉਂਸਲਰ ਮਾਰਟਿਨ ਮਿਡੀਰੋਜ਼ ਦੇ ਨਾਲ। ਜੇ ਤੁਹਾਡਾ ਕੋਈ ਸਵਾਲ ਹੈ ਜਾਂ ਫਿਰ ਆਪਣਾ ਕੋਈ ਵਿਚਾਰ ਤੁਸੀਂ ਸਾਡੇ ਨਾਲ ਸਾਂਝਾ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ ਤੇ ਜ਼ਰੂਰ ਲਿਖ ਕੇ ਭੇਜੋ feedback@ptcnetwork.com ਤੇ। ਫਿਲਹਾਲ ਮੈਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ ਅਤੇ ਦੇਸ਼ ਦੁਨੀਆ ਦੀਆਂ ਤਾਜ਼ਾ ਖਬਰਾਂ ਲਈ ਤੁਸੀਂ ਵੇਖਦੇ ਰਹੋ PTC ਨਿਊਜ਼।